Good morning. In today's topic, we are going to discuss on tooth numbering system or nomenclature. First of all, why should we have a numbering system for teeth? As every individual has an unique name to be addressed, when we have a numbering system or nomenclature designed for teeth, it becomes easier for identifying or referring the teeth when we decide a treatment plan. So as you all know, the human dentition can be divided into primary dentition and permanent dentition. The primary dentition is also called as deciduous dentition, and the secondary dentition is the one which is called as a permanent dentition. So the other name for the primary teeth is the predecessor teeth, and the permanent teeth are referred to as succedaneous teeth because they succeed the primary teeth. So the two types of dentition include here deciduous dentition because they exfoliate, and then we have the permanent dentition which is going to be retained till the lifetime of the patient. So we have something called as a dental formula which makes it easier for identifying the number of teeth in each set of dentition. That is, in deciduous dentition or the milk teeth as they are referred to, we have two incisors, one canine and two molars in each jaw. That is, the maxilla has got two incisors, one canine and two molars, which makes it a total of 5 plus 5 into 2, which becomes 20. For each quadrant we have two incisors, one canine and two molars. So for a maxilla we have 5 on either sides, which makes it a total of 10. So maxilla 10 and mandible 10, which makes it up to a sum of 20 teeth in the deciduous teeth. Wherein in permanent we have two incisors, one canines, and additionally we have two premolars and three molars on each quadrant. So on the maxilla we have 16 teeth, and in the mandible we have 16 teeth, which makes a sum of 32 teeth. As coming on to the types of tooth numbering systems, there have been several tooth numbering systems designated for easy referral and identification of teeth and for usage benefits. So the main numbering systems are the Sigmonti-Palmer system, Universal system, and the FDA, Federation Dental International system. These three are the most commonly used numbering systems for both the deciduous as well as the permanent. So first we will see about the Sigmonti-Palmer system. It is also called as the quadrant system or the grid system because in this numbering system we divide the jaws into quadrants or grids for easier identification of right or left side of maxilla or mandible. So for deciduous dentition, you can see we have divided it into the maxilla into right quadrant and left quadrant, and the mandible as well as into right quadrant and left quadrant. So in deciduous dentition, after dividing the quadrants, to designate the teeth we use the alphabets. So these alphabets start from the central incisor to molar. So for central incisor we give the alphabet as A, lateral incisor is given as B, canine is denoted by the alphabet C, first molar is denoted by D, and the second molar E. This holds same for all the quadrants as well as both in the maxilla as well as in the mandible. So we are just dividing the quadrants and designating alphabets from central incisor to molars. So this is just a briefing of individual numbering system of deciduous teeth as per the Sigmonti-Palmer system. So for permanent dentition also we follow the same pattern of dividing the maxilla and mandible into quadrants, but here the difference is going to be we are going to use numbers rather than alphabets for denoting the teeth, individual teeth. So here we are going to use the numbers from 1 to 8, 1 to 8. Always remember in Sigmonti-Palmer system the numbering is going to start from the central incisor and proceed distally towards the third molars. The same is true for all the quadrants, all the four quadrants, the same rule applies. So according to the Sigmonti-Palmer system, for permanent dentition, we use number 1 for central incisor, 2 for lateral incisor, 3 for canine, 4 is used to denote first premolar, 5 is used to denote second premolar, 6 is used to denote the first molar, 7 is for second molar, and 8 is for third molar. So This is going to be repetitive for all the quadrants, except that we use alphabets in Sigmondi Palmer and numbers for permanent. So as you can see, this is the detonation of the teeth in permanent dentation for the Sigmondi-Palmer notation. The advantage of your Sigmondi-Palmer system is that orthodontists use this because it allows discussion of particular teeth that require treatment very easily, and the quadrants are easily identified by symbol. But the main disadvantage that you encounter with Zygmundi-Palmer system is that it is incompatible with computers and words processing systems. You cannot feed the quadrants. Universal system. So here also we use alphabets and numbers for deciduous and permanent teeth respectively. That is, for denoting the teeth and deciduous teeth we use alphabets, and for denoting the teeth and permanent dentation we use in numbers. But here we are not going to divide the jaw into quadrants as we do in the Zygmundi-Palmer system. There we divided into quadrants and we used alphabets only from A to E for numbering the individual teeth. Same way as the numbers we used only from 1 to 8. But here it is going to be slightly different. Only similarity between the Zygmundi-Palmer and universal system is that alphabets are used for deciduous teeth and numbers are used for permanent teeth. So for example, the maxillary teeth are designated as A to J, starting from right maxillary second molar to left maxillary second molar. Here also you can see the difference. There in Zygmundi-Palmer, though we use the alphabets, A started from central incisor and proceeded towards the second molar. But here we are going to start. The first tooth is going to be the right maxillary teeth. You got it? So the right maxillary teeth is designated as A and it continuously proceeds, and J is assigned for left maxillary second molar. And for the mandibular teeth, K is for left mandibular second molar and it ends with T for right mandibular second molar. So we're going to start So you're going to start from your right maxillary second molar, proceed, and same way as you're continuing in the left mandibular molar and finishing it off at right mandibular second molar. So the beginning point is right maxillary second molar and the ending point would be your right mandibular second molar. So it goes clockwise. Okay. So here we've used 20 alphabets from A to D because the number of teeth is 20 in your deciduous dentation. Same as in permanent dentation, we're going to use numbers from 1 to 32. Okay, there is not going to be a repetition like 1 is for central incisors. Through all the central incisors are designated as 1 in Zygmundi-Palmer system, but here it is not that way. We're going to start from the right maxillary third molar. So number 1 is given for right maxillary third molar and it proceeds clockwise and ends in right mandibular third molar. So as you see in the picture here, you can see the right canine, the right maxillary canine is given 6, whereas the left maxillary canine is given 11. So here also we follow a clockwise pattern starting from your right maxillary third molar and finishing the numbering at the right mandibular third molar. It is not difficult to be fed in the like the Zygmundi-Palmer system. And finally, we have the FDA system, which is accepted in International Association for Dental Research. This system, by abbreviation, it's called as Federation Dentaire International. It's also called as the other names for this system are two-digit system and ISO system because it is also called as the International Organization for Standardization Designation System. So we call the FDA system by other names like two-digit system and ISO. Now you can ask me why it's called a two-digit system. Here to designate the quadrants we are using a digit and for the teeth we are using the second digit. So there are going to be two digits. The first digit will denote your quadrant and the second digit will denote your teeth. So as I said, the first digit is going to be quadrant. So we are going to use numbers 1 to 4 for permanent teeth and 5 to 6. Here we are not using alphabets at all. We are going to use only the numbers, but 1 to 4 is designated for permanent and 5 to 6 is designated for deciduous. The second digit denotes the tooth within that particular quadrant. For example, so here the right maxillary quadrant is designated as 1. Left maxillary quadrant is designated as 2. So all the teeth in the left maxillary quadrant will begin with number 2 as the first digit. all the teeth in the mandibular left quadrant will start with 3 as the first digit, and here you can see 4 is the first digit for all the right mandibular teeth. So this is going to be same for all the teeth in the quadrant, but then the number, the second digit, will denote the individual numbers, which is similar to your Sigmondi-Palmer system. We're going to use numbers from 1 to 8. Okay, starting from the central incisor to 8. So if I have to denote my left maxillary second premolar, I'm going to use, for the left maxilla, the number would be 2. The quadrant number would be 2, and for second premolar, the number is 5. So I am denoting it by 2, 5. Also remember, should not call it collectively as 25. It is supposed to be named as individual digits: 2, 5, 3, 8, 3, 4, not 34, not 33. It shouldn't be addressed that way. That is completely wrong. And in deciduous dentition, if you see, we are designating numbers 5 to 8 for the quadrants, as I have already mentioned. So 5 denotes your right maxillary quadrant, 6 denotes your left maxillary quadrant, 7 denotes your left mandibular, and 8 denotes your right mandibular. And numbering is going to be 1 to 5, 1 for central, 2 for lateral incisor, 3 canine, 4 is first molar, and 5 would be your second molar. So the advantages of this FDI system would be, the dentist use this system because numbers given to a particular tooth are unique. And this method of denoting the tooth is very compatible with all computers and word processing software. Also, it is easily communicated. Like when I say 3, 4, it is understood that I am denoting left mandibular first molar, because 3 is for left mandible permanent dentation and 4 is for your first premolar. So that it becomes easy for communication. So this slide shows the comparative feature of all the three numbering systems here for each tooth. For example, this is the universal system where we are using just the numbers, and in quadrant system we are giving the grid or the quadrant. In Sigmondi-Palmer the quadrant system, and in FDA system we are using 2 digits. I hope that clarifies the tooth nomenclature system. Thank you.